I don't see any reason that it should not be the same for healthcare and our ability to plan for it, to view what we have done and what we need to do. And I think FHIR really takes us a step further in that particular direction, in the sense that, like Daniel spoke about before, there have been efforts towards interoperability, but they've been very, very healthcare specific. FHIR is a standard that uses kind of agnostic technology underneath it. It doesn't have to have a specific healthcare approach to it. And so it opens the door for a lot of other vendors to get involved because they don't feel so gated by what's going on in this particular process. And I think it speaks to why we have adopted FHIR as kind of our approach from a virtual health perspective. While our Helios platform does have its own proprietary data structure underneath it with which to operate a lot of the care and utilization management pieces that we have, we've adopted FHIR via our HELIOShub product, which now allows us to talk with a multitude of other systems that are also FHIR compliant. HELIOShub does work with things outside of FHIR, but its core process really is surrounded by it and enabling that. And so we now have systems that are incorporated with 3 or 4 different external source systems that then feed that longitudinal patient record. So we can now see their medical history, we can see their upcoming episodes or their schedules. From an authorization perspective, we can receive requested authorizations from providers directly, so that care managers and utilization managers don't have to go, digging into multiple different systems in order to check, hey, what exactly do we need to get this patient scheduled for or serviced for in order to address risk scores and other things like that. So yeah, just a little bit of a personal and professional insight into how I think that driving that patient engagement from a FHIR perspective has helped and will help a lot more in the future.